as human beings, my feeling is generally doing something more makes us feel better rather than sitting and watching. So, I give you an example. I am your oncologist, you have treatment with me, you go and then you talk to another patient or you talk to a naturopath and they say, we have had great success with this drug, some of the patients have had great result, all you have to do is swallow this with 1 glass of water and tap your head 5 times. Now, if 100 patients do it, then they are feeling they are doing more than what the other 100 are, and because they are doing more, the other 100 think we are not, so we are missing out, so we should do it as well. But whether that actually leads to a better outcome or not, we do not know. In general, if we pay something from our pocket, we do something more than the average or extra, as human beings we will feel we are doing more. But the answer is nobody knows 100% whether there is benefit in doing that. It may make you feel better, but I say to the patients, like the biggest one that is coming is cannabis. Nobody actually knows medical cannabis, whether it has any anti-cancer properties or not. It is being sold like that. I say to the patients, it's a free world. I cannot recommend you on treatments that my system of medicine doesn't do. However, if you feel strongly about it, do it, but please tell me. Lower vitamin D levels are seen more frequently in women who have breast cancer. But what we do not know is if we raise the vitamin D level, is the outcome any better? Like, is there another factor that causes breast cancer and lower vitamin D levels? Or is there a factor, like I'll give you an example. When first esophageal cancer was diagnosed and people were, statisticians and epidemiologists were doing the studies, they found that people who drink alcohol used to have more food pipe cancers. And then they worked out that it was not actually the alcohol, it was the smoking that caused the food pipe cancer. Just because you smoke, you tend to also drink, but if you drink doesn't mean it necessarily causes it, it's this factor. So, it is very easy to develop that, and certainly in patients who are on bisphosphonates and things, they should be on vitamin D and calcium, and that is my standard practice. But whether doing that just makes you feel better or does anything to your cancer is questionable. If there is any evidence which is strong, you will actually see guidelines, you will see it on the newspaper, you will see it on the TV like you've seen with that immunotherapy drug for lung cancer, and oncologists everywhere will recommend it. Why would oncologists not recommend something simple as omega-3 if the evidence was very strong? Not everything Dr. Google says is 100%. But if you want to do it, I say to my patients, do it, but please tell me what you're doing.